Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Health Talk, Thursday mornings, every Thursday morning at this time, brought to you by Mon General Hospital. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, James. This seems to be an ongoing subject, women and their health.
As long as women keep having babies, we'll probably still be talking about it here on Health Talk.
Keep having babies.
Let's welcome back Dr. Shane Prettyman, OBGYN from Women's Healthcare. How you doing?
Good. How are you doing?
I'm doing well, and it's good to have you back here today. So what area of your practice are we going to focus on today?
Oh, I thought you guys were going to tell me what we were going to talk about.
All right. Well, let's talk about, first of all, I understand the birthing center is expanding. So tell us, can I go hang out at the birthing center and have a cup of coffee and watch what's going on?
I hear it's nice enough to do that.
There's a viewing room.
A viewing room?
No. There is. So there's been plans for a while to expand the birth center for new renovations. So I believe the tentative date, for starting renovations will be this summer, I think in September. And I think it'll be about a 10-month process. So hopefully by late or middle of next summer, we'll have a completely renovated new birthing center, which would be really nice.
Okay, then why do we have a birthing center? It used to be you went to a particular floor at the hospital, and that was the place where women had their babies.
Well, I mean, to a certain degree, it still is. We call it the birthing center, but it's currently right now on the 5th floor of the hospital. One of the main focuses will be the expansion of the room. So currently we have 8 rooms where a patient will come in, deliver her baby. She'll labor there. She'll deliver her baby, and then get to spend the next 2 to 3 days in the same room. We have 8 of those right now. The plans are to expand those to 16 rooms. Currently, since we only have 8 of those rooms, we have a lot of smaller rooms, and sometimes when we're a lot busier than others, we have to, after a patient delivers, we have to send her to a smaller room, sometimes far down the hallway, which is just not ideal. It's honestly not ideal to have them change rooms at all. So we'll expand the room so they can stay in the same room from beginning to end of their stay, and it'll be very nice.
Back in the 90s, when more health management organizations were involved in medicine care and doctor care, it seemed like they wanted women to have their babies and get out of there, go home after a day or two. It's good you mentioned 2 or 3 days or however long they need now, right?
Exactly. So it'll be nice. There definitely is not a rush to get them out, but you would be surprised. Most of the patients do want to get home, kind of get on with their life pretty quickly.
You're telling me you're not getting them out in 24 hours? I mean, why are they staying 2 or 3 days?
On average, it's 48 hours that a patient's there, whether it's a vaginal delivery or a C-section. And it usually takes 24 to 48 hours for them to be stable enough to go home. And in addition, the majority of the time, the pediatricians want to watch the baby for 48 hours to make sure everything is fine. So kind of the 48-hour mark is average for when the mom and the baby get to leave the hospital together.
Yeah, I want to talk about these birthing centers because, I had my babies back in the late 60s, early 70s. And back in then, you had a little room, and then you went off and you had your baby somewhere else. And now it makes it almost look like a living room scene. I mean, it's so comfortable. You have couches and running water and bathrooms, right? I mean, it's huge. I've been in those rooms. And why are you going to this expense? Why do you think it's better to have these really big, comfortable rooms?
I mean, overall, I think it just it increases their satisfaction and their experience for their birth. To have an environment that is very friendly, very warm, where you do feel like you're at home. Plenty of room for family and visitors. It just increases your satisfaction.
Yeah, that's the big thing, family and visitors, because another change back when we had our children, they didn't want anyone in the room except the father, period. After you had that baby, they would not allow anyone to come in around your baby. They were behind a glass window. Why have these things changed? I'm just curious.
Why? That is a good question.
Because women wanted it.
Is that why? Or do we find that really everybody's not carrying as many germs as we thought, or this makes the wife more comfortable, or the woman, wife, what am I thinking?
I mean, I would have to say it's probably a combination of everything. I mean, there's no reason to keep the baby, sterile behind glass windows. I mean, obviously, common sense to wash your hands, and if you're sick, to not be around a newborn baby. But as far as coming and seeing the baby and spending time in the room, I mean, I think that's fine. And another thing, kind of along those lines, are the fact that in most women, a lot of women want to keep the baby in the room the entire time with them, from the time they're born until the time they're discharged. So we can do that. There is no reason that the baby has to go and spend time in the nursery unless the mother really wants that.
Yeah, Jim, that was another change. I mean, they would bring your baby in, you would feed that baby, then they would take that baby, and you wouldn't see it again till the next feeding time. And I think this is wonderful. And the reason it gets you to make contact with your baby faster and bond. And I think that's good for the whole family.
Definitely.
So if you have any questions or comments for Dr. Prettyman this morning, we're talking about childbirth and also the expansion of the birthing center. We want to know more about that. 304-296-0041.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Dr. Shane Prettyman is our guest today from Women's Health Care. And all births are always perfect, right? Feel the contractions at home, get to the hospital on time, have the baby, and out in 2.5 days.
Exactly.
They're all perfect, right? No, they don't happen in cabs anymore, or in the back of the car, or along the road, or even in your office, right?
I think that Sheets right off of 79 coming into town, they've had a couple of babies there.
Where were you born? I was born at Sheets. That's great, and I had a 10% discount. We're talking again about, OBGYN related issues, and the birthing center has expanded or is expanding at Mon General Hospital. So with this birthing center, what can you do now that you couldn't do before?
Currently, we are able to deliver babies from 36 weeks gestation and beyond. Currently, if somebody comes in preterm labor or has complications necessitating a delivery prior to 36 weeks, we need to send them to a higher level institution, specifically WVU, to deliver their babies. And that's mostly because they have a NICU and they have better capabilities of handling premature babies and babies that are sicker. Starting with the expansion of the birth center, we partnered with some neonatologists from WVU who will be assisting us to deliver babies 32 weeks and beyond. So starting with that, we'll be able to deliver at 32 weeks and beyond. So hopefully less of our patients will need to be transferred to WVU. And
when it comes to delivery, I know that in Kay's day, which really wasn't that long ago, although
it was a long time
it seems like it, but it was a cesarean section last resort. I mean, if there was some kind of problem, breach or something in the regular delivery, vaginal delivery, that was the last resort. It seems more and more women these days, we hear about getting C-sections. May not be a last resort anymore?
Well, it still should be a last resort. It definitely still should be. I mean, the safest way and best way for a baby to be delivered by far is a vaginal delivery. There are certain reasons and indications for a C-section, but all in all, it should be a last case resort.
Okay, what are the reasons today, or have they changed?
So probably the biggest change, depending on who we're talking to, would be doing a C-section for a breech baby. So 20, 30 years ago, a lot of babies, when they were breached, they were delivered vaginally. There was a study that came out 5 to 10 years ago that showed that babies are more safe when they are delivered by C-section if they are breached. So now standard of care is if somebody is breached, we can talk about certain maneuvers to see if we can try to turn the baby so the baby is now head down and they can have a vaginal delivery. But if they do not want that, then the standard of care would be to do a C-section.
Has the incision size changed at all? I mean, the babies haven't changed, so I'd imagine the incision hasn't changed. Anything about a C-section that's changed?
No, I wouldn't say so. I think C-sections have been the same for the past, how long? Hundreds of years.
Same recovery time, everything.
Yeah, still 48 hours.
If a woman would come to your office and ask to have a C-section, say she's 3 or 4 months in, she doesn't know what's going to happen, but she just knows she wants to have a C-section because of the pain involved in having a baby. Would you agree to that?
That is a very hot topic right now in OBGYN. the majority of physicians, including myself, would strongly discourage doing an elective C-section. Again, certain indications you would want to do a C-section, but by and far babies are safer and mothers have a healthier, quicker, better recovery after a C-section. C-section, though it's very routine, we do them all the time, and by and large they're extremely safe. It is still major surgery. There still can be complications, and the recovery from a C-section is significantly different than the recovery from a vaginal delivery.
Tell me why, and I can give you examples in family, that some women can go in and have a few pains and bam, have her baby and it's over. And some women go in there and they're there for 8, 9, 10, 12, 13, 14 hours trying to give birth. Is it the way our body's made up?
To a certain degree, yeah. It's multifactorial by and far. A lot of times with your first baby, labor is longer, pushing is longer. So the first baby usually is longer. Second, third, fourth baby usually a lot quicker. It also depends. Do you come in active labor? Are you needing induced? Again, that should be for a medical reason. So it's very, very multifactorial as far as.
You know what I'm saying, though.
I know
Some
exactly
women
what you're
can
saying.
breeze right through it.
Yes.
Yeah, and I was just wondering about the pain medications for a vaginal birth. What's the standard now, or is there one?
I wouldn't say there's a standard. There's a big variety, anything from no medications at all to some medications in your IV to an epidural or any combination thereof. And again, it depends on a patient's personal, pain threshold, their desire, and again, the indications following, around their delivery as far as if they need induced, how quickly things are progressing.
Are those things decided before the day of birth?
They should be as much as possible. I think that's why prenatal care is so important, is so that you can talk about every scenario. I guess you can never talk about every scenario, but a lot of the scenarios, so that you have an idea and a game plan when the day actually comes. But then again, you never know exactly what's going to happen leading up to your birth. But they should all be talked about ahead of time.
You're a young guy. You're not. I don't know if you can answer this question. It just seems to me that women are more educated about giving birth today, and they have a better understanding of what to expect than many years ago. Why is that?
I can't tell you why they're more educated. I think it is very important. Again, is it the internet? I'm not for sure.
It's riveting programs like this one.
Exactly. They're reading a lot more. I would like to think that, a lot of the education comes from the prenatal care, but they're more informed, and I just think that makes for a smarter patient and a better overall delivery and experience.
If a woman chooses not to have any kind of pain medication during birth, are there any supplements prenatally that would help the delivery along, or any kind of vitamins? I know that folic acid is important prenatally, but I'm just wondering, for those holistic people who don't want to have anything to do with medicines, if there anything that they take to ease the childbirth.
No, not that I'm aware of, or at least routinely practice, no.
Yeah, but folic acid's one, right? What does that do?
It is important to take your prenatal vitamin that has folic acid, which helps with the development of the spine. So very, very important.
And I'll bet those same women, Jim, that you're talking about are very in tune to their bodies. They have a lot of good nutrition, good food, and I bet they exercise during their pregnancy.
Yes, I think a fit mother, without a doubt, helps with labor, delivery, and the recovery.
A lot of times they use the midwives that are available to them too.
Yes, with our
What's your favorite word?
Midwifery.
Yeah.
The science of midwifery. You have midwives working in the birthing center?
We do. We have midwives that work in our practice, and it's a great experience. So with our practice, you have a variety. You can have, a combination of midwife and physician care, or you can go with just midwife or just physician care.
What's a male version of a midwife called? Are there any such things?
I'm sure there is.
There's got to be some male midwives out there. I'd like to hear from you this morning. 304-296-0004. Would you be a mid-husband?
I suppose so.
Mid-man. Pregnancy tests, the accuracy of those are startling these days. And or are they? I mean, they seem to be. Anyway, women take.
You held your hands out, palms up. People will see that in the video, but on radio, we don't know what that means.
But why I asked that question, it would seem to me, because of these pregnancy tests and women finding out very early that they think they're pregnant, that may get them to the doctor soon.
Well, that would be the hope. They are, yes, they are very They're accurate. They're very sensitive. You definitely can find out before you have missed your period if you are pregnant. And again, cannot stress the importance of prenatal care, the importance of early detection of pregnancy. Speaking of folic acid, I mean, you need any woman of reproductive age. So, I mean, we're talking from teenage on up, truly needs to be on folic acid, because the most important time to have folic acid in your system is honestly prior to you knowing that you're pregnant in the first about 8 to 10 weeks.
Poor Jessica Simpson. I'm so tired of people picking on her.
I am too. I heard the guys across the hall this morning talking about that she was big, that she like delivered a couch or something like that. That's just rude.
What they compared her to just last night, I saw a woman that had 6 children. She gave birth to 6 children. She had gained 55 pounds. They compared that to Jessica Simpson, who had also gained 55 pounds for 1 child. So my question is there a safe weight in when you become pregnant that you should gain or not gain?
There is. The weight that you gain is dependent upon the weight that you gain prior to pregnancy. If you're a very thin female, you should gain more. If you're overweight to start with, a lot of times you don't gain very much. On average, 30 pounds during a delivery would be average, but we see anywhere, we see less than that. We see significantly a lot more than that. Personally, true or not, I don't know. I think the size of the baby is pretty independent of the weight that you gain during your pregnancy. It's more dependent on how big the placenta is, how big the umbilical cord is, and those are things that are out of our control.
We're going to take a break. One last question before we take the break. That is, Kay mentioned the accuracy of the test results to determine whether you're pregnant or not. What's the percentage of women that see that result and go, yes, and the women that see it and go, oh, no?
Oh, that's
it's about 50-50?
I would say it's about 50-50.
All right. We'll take a break and be right back.
Me.
Oh, no, I'm pregnant. Yes, I'm pregnant. All right. It's just a difference. Depends on who you are, whether you're type A or type B.
If you're married, yeah.
Back in a moment.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Yes, Dr. Shane Prettyman, living every dream a little boy has of being a gynecologist, an OBGYN. And we're talking today about giving birth. Now, if we have the childbearing years ahead of us, but perhaps we're not pregnant right now, should we still make regular appointments with our OBGYN?
Yes.
Why?
There are many things that we talk about on a regular basis. Anything from general health, from diet, exercise, to sexual health, to contraception, to later in life, periods, menopause, bone health, mammograms, colonoscopies. So it spans the whole spectrum. But yeah, starting from an early age, it is important. Teenagers should come in to the GYN doctors.
We talked about the weight of women giving birth, but even those childbearing years, can you have trouble conceiving if you're overweight or too skinny, or you have certain lifestyle changes that need to be made?
Yes, without a doubt. We see a lot of patients that have trouble getting pregnant. A lot of that has to do with lifestyle. A lot of it has to do with factors that are out of control of the male and the female, but hopefully that we can influence to try to get them pregnant.
And you say that we can go hang out in the birthing center and
in time. It's only 8 rooms now. It'll be 16.
We can have some coffee, watch some TV, see some babies being born, and
yes.
Take bets, really. Who's going to deliver first, Lady A or Lady B?
Not a place to hang out unless you're part of the family, right?
That's right.
Oh,
Exactly. I would
okay.
suggest that. Be part of the family.
All right. Any family members listening to me this morning that's pregnant, give me a call after the show, and we'll go hang out at the birthing center.
Good information, though, and I'm glad to see that the birthing center is expanding and really offering more for the public and for women in this community. Thank you very much.
Women's Healthcare, is that located in Suncrest Town Center?
Suncrest Town Center.
All right.
Kroger's.
And the name is Prettyman. Look for it in the book, I guess, right?
Yes.
If you need an OBGYN or you want to suggest one for somebody that you know that's going to be giving birth, then look for Dr. Shane Prettyman.
And he's very calm.
Women's Healthcare.
Very calm.
Health Talk comes your way every Thursday morning at 8:35, brought to you by Mon General Hospital. And videos of these programs, all of them, available on the website, the Mon General Health site, mongeneral.com. Is that correct, Greg? Yes, thank you. I think it is. Stay tuned for... I wasn't going to turn on your mic. Stay tuned for Morgantown AM after the news next on the Voice of Morgantown, 1440 WAJR.